So I know we've talked about like different medicines that you can give your dogs as a dog breeder, but here's the dark truth that a lot of people don't know when it comes to giving any kind of medicine really to your dog. Stay tuned, you're not going to want to miss this episode of Breeders Hacks. All right, guys.
What if I told you the right outcome? What's going on, Bully fam?
What's going on, Bully fam? It's your boy, the educator, the scientist, Mr. Double Muscle Line Bulls, bringing you another episode of Breeders Hacks. So today, I wanted to talk about the dark truth about like a lot of these medicines that you can be using for your dogs, right? So we've done videos talking about like many of the different medicine that you can give your dog. Now, I mind you guys, as always, like I say, disclaimer, I'm not a vet. I'm not your vet. You should speak to your vet about any kind of medical advice. I'm just a breeder that's been doing this for like the past decade. And I just share the information that I've learned with you guys, right? So the dark truth though, right? When it comes to giving your dogs any kind of medicine, any kind of antibiotic, like this is like a form of Clavamox, for example, or they would call it like Augmentin, that is like great for all dogs and puppies, but there's a dark truth behind a lot of these medicines, right? Not just this, all kinds of medicine. And the truth is that you have to be careful. You have to be extremely careful when it comes to using like any kind of medicine for your dog, right? That's why I always say like you should consult your vet. Not just that, but getting the veterinary drug handbook, the Plums book, I've done videos talking about it. Like it gives you the information needed to be more educated when it comes to giving your dogs any kind of medicine. And the reason being is because there can become what's called antibiotic resistance, whether it's your dogs, whether it's the viruses, the parasites, whatever the case it may be. Like when you overuse anything, right? And I've seen this happen time and time again, and this is why I want to warn you guys about this, is I've seen time and time again where breeders will have issues with their dogs, and all they do is, I'm going to put the dog on amoxicillin, or I'm going to put the dog on cephalexin, and they do it every single time they have a problem. Well, what happens is now, when they really do have a severe problem, those medicines don't really have the same effect that they once did, whether it's because the dog's body had just gotten so accustomed to having it in its system, or whether it's because of the fact that the viruses started to mutate and become more resistant towards the medicine. I mean, the list goes on. You guys could look it up online, antibiotic resistance and things like that. So you want to use things sparingly. Like, for example, a lot of people, they'll use like enrofloxacin or Baytril for a lot of things. And that's pretty much like the strongest antibiotic you can use. So now what happens if you use that all the time, and now whatever virus you're trying to battle is resistant towards that, right? Because you've been using it so frequently, now the viruses have been able to combat that antibiotic, and now it's not treating your dogs the way it once did. Now you're losing dogs and things like that. So you have to be careful. There's a reason why, for example, a vet may start with something very, very more light, like amoxicillin and or potassium coagulant. There's a reason why a vet will start with an antibiotic that is a little bit more weaker in the beginning to try to treat the infection or whatever the ailment may be, rather than going with like the strongest thing right out the gate. Because of that, because what happens is you use the strongest antibiotic every single time. Well, what happens now when that doesn't work? You don't have anything stronger to use. This is a quick episode. I just want to share that with you guys. Like, just be mindful when you're using the medicine. You don't want to just use, like, say, one thing for everything. You want to use things sparingly at an appropriate dosage. And that's why I can't stress enough having like a veterinary drug handbook just for your own notes and your own references, as well as consulting with your vet, and used appropriately. Say, for example, dealing with some kind of infection, and we use like a form of Clavamox, and then maybe that doesn't work, then we can go to something stronger like a Baytril, or using Baytril with Clavamox and knocking out whatever the infection is. So it's just the dark truth that a lot of people will not tell you when it comes to trying to give like medicine to your dogs, is there really is a such thing as like an antibiotic resistance, and it's scary. That's actually what kind of happened some years back with amoxicillin. Amoxicillin used to be extremely effective for dogs, but what happened was, whether it's the dogs or whether the viruses started to become a lot more resistant to the amoxicillin, and it wasn't as effective as it once was maybe 10 or 20 years ago. So that's why like adding like things like potassium clavulanate to amoxicillin allowed it to become stronger and be able to be more effective now. But they had to add these things because, again, antibiotic resistance. I just wanted to share this information with you guys. Like I said, I hope it's helpful. I hope it's useful. Just use your medication sparingly. Don't be afraid to, talk to your vet. Check out the veterinary drug handbook. Don't take my word for anything. So hopefully this information can keep your dogs happy, healthy, and I hope it's helpful and I hope it's useful. And I'll see you guys on the next episode of Breeders' Hacks. Make sure to drop a comment down below and, let us know your experience when it comes to any medicines that you've had to give your dogs. All right, guys?